In other news today, Austin area hospitals once again running low on staffed ICU beds. There's only 2 adult beds available right now, up from 0 last night. The Texas Department of State Health Services is also reporting 5 available staffed pediatric ICU beds. Now, this applies to an 11-county area that serves nearly 2.4 million people. And as KVUE's Jenny Lee reports, the cause is still a nursing shortage that some predict will only get worse.
Trauma Service Area O, which includes Austin, hit a milestone Sunday night.
We are really concerned when we have this situation occur.
According to the Texas Department of State Health Services, there were 0 available staffed ICU beds for adults. The persistent problem?
We are having a staffing shortage right now.
Monday numbers show a slight improvement, with 2 available staffed ICU beds for adults and 5 for pediatric patients. Austin Travis County Medical Director Dr. Desmar Walks says Austin area hospitals are dealing with the nursing shortage the best they can. There's nowhere to send patients because other hospitals are handling COVID surges as well.
They'll be moved to non-traditional care areas like the recovery rooms for surgery areas and cath labs where normally cardiac caths occur.
Selena Shea is an ICU nurse at an Austin hospital.
It's just really emotionally, mentally, and physically exhausting.
She says the state has sent FEMA and travel nurses, which has helped, but it's not enough. She says the shortage leads to dangerous working conditions for them and patients.
I think we're already seeing ways in which patient care is deteriorating because we don't have the staff. So blood sugar checks get missed. We have a much larger workload than we're used to, a 50% increase in our workload. And so we're already starting to see effects of that.
Shea says there's also the element of compassion fatigue. Some nurses are getting tired of unkind patients and families, as well as risking their lives for those who have chosen not to get vaccinated. In Austin, I'm Jenny Lee.
Ascension Seton, Baylor Scott and White Health, and St. David's Healthcare tell us they're working together to optimize hospital capacity. Now, they sent us a joint statement that says in part, quote, while we will always make emergency care available, we may also have to adjust our staffing needs and limit the services we're able to offer to patients. In some cases, we may transfer patients between facilities within our healthcare systems in order to provide the most appropriate care, end quote. Now, they also encouraged everyone to get vaccinated.